Good afternoon, this is TTT Live and TTT Live online on Facebook. I'm Dike with a COVID-19 review. The number of confirmed COVID-19 cases in Trinidad and Tobago has held steady at 116 since Sunday night. In its latest update, the Ministry of Health says 6 COVID-19 patients remain at the Couva Hospital. This is 2 patients were decanted to the Home of Football step-down facility. Some 72 people have so far been discharged from hospital. A total of 30 COVID-19 patients are at step-down facilities. All of these patients are said to be low risk and stable. The Ministry of Health is reminding the public to continue safety protocols by washing hands with soap, using hand sanitizer, social distancing, and generally wearing masks in public. Now for a look at the effects of COVID-19 in the Caribbean region. The Prime Minister of Barbados, Mia Mottley, announced a $2 billion recovery plan designed to stimulate businesses and provide relief for the most vulnerable over the next 2 years. In an address to the nation on Wednesday night, she said the government of Barbados is set to lose more than $450 million in revenue over the next year. She added that a $400 million stimulus package for businesses to keep staff on the payroll would also be implemented.
Just before COVID-19 struck, our reserves had reached $1.55 billion, the highest level at that time recorded on a like-for-like basis for a while. Today, as a result of the low-interest borrowing from our partners, the Inter-American Development Bank being the most recent one, our reserves today, as I speak to you, are just over $1.7 billion. It is more than enough reserve cover.
In St. Lucia, the Prime Minister and Minister of Finance, Alan Chastanet, presented a $1.7 billion budget on Wednesday in the House of Assembly. He said COVID-19 and the impact on St. Lucia's economy changes the financial situation daily. Prime Minister Chastanet said the US $30 million loan from the International Monetary Fund will assist in meeting government's recurrent expenditure.
So just last night, Mr. Speaker, the IMF board agreed to lend St. Lucia $30 million US. We were among 2 other countries, Grenada and Dominica. And I want to really congratulate and thank the Director of Finance and her team for the extraordinary efforts.
The government of St. Kitts and Nevis will continue to proceed with due caution as it gradually moves to bring the country to a sense of near normalcy in the wake of the ongoing COVID-19 pandemic. The country's Prime Minister, Dr. Timothy Harris, said his team Unity administration will continue to be guided by the advice of local, regional, and international health experts as it relates to the relaxation of restrictions in the Federation.
I am optimistic that together, St. Kitts and Nevis would emerge as a stronger, better, and safer place in the future. Clearly, our team Unity government has demonstrated that we have a long-term plan to keep St. Kitts stronger, safer, and healthier after COVID-19.
Dr. Harris also reminded the nation that the borders to St. Kitts and Nevis will remain closed for as long as there is a health challenge or risk to the country. Now, the World Health Organization is investigating whether the coronavirus causes some children to develop a rare inflammatory disease, which is being likened to toxic shock syndrome and Kawasaki disease by some doctors. Health officials in the United Kingdom warned doctors over the weekend that COVID-19 could be causing a rare inflammatory condition in children. According to Britain's Pediatric Intensive Care Society, many but not all of the children with symptoms of the new inflammatory disease had been diagnosed with COVID-19. Technical lead of the WHO Health Emergencies Program, Dr. Maria Van Kerkhove, said they are paying close attention to this development.
We are aware of this report, which came out of the United Kingdom, about a small number of cases amongst children with its inflammatory response. We're looking at this with our clinical network, and in fact, our clinical network had a teleconference yesterday which discussed this. And if I can remind you, we have a global network of clinicians that are dealing directly with COVID-19 patients across the globe, and they meet at least once a week, if not more, to exchange information.
She said the clinical network meets regularly to better understand how this infection affects the body. Dr. Van Kerkhoff said that there are also some recent rare descriptions of children in some European countries that have had this inflammatory syndrome, which is similar to the Kawasaki syndrome. The WHO has asked its global network of clinicians to be on alert for such cases around the world.
What we've asked for is for the global network of clinicians to be on alert for this and to ensure that they capture information on children systematically so that we could better understand what is occurring in children and so that we could better improve our understanding and guide treatment. But it seems to be very rare and only in maybe 1 or 2 countries so far, and in a number of countries, and additional countries, they have not reported this yet.
The coronavirus, which is primarily a respiratory disease, is affecting more than just the lungs, as first thought, according to Executive Director of WHO's Emergency Program, Dr. Michael Ryan.
You know, obviously is causing inflammation and attacks tissue other than lung tissue. And we may be we are in a situation where clinicians are looking at what those other effects of having this coronavirus infection are. And we've seen this in the past with many emerging diseases. They don't necessarily only attack one type of tissue. There can be multiple organs affected, and many of you have seen the reports of other organs that have been affected with this disease.
Dr. Ryan said it is very important that researchers look further into such reports to better understand the nature of the virus and the disease it causes. Now, it is Thursday and therefore time for a mental health moment courtesy of TTAP, that's the Trinidad and Tobago Association of Psychologists. The COVID-19 pandemic is currently forcing millions of people to adopt new ways of life which may be strange and solitary. Arlene Maximay is a counselor, she's a student counselor and school psychologist ready to speak to coping with loneliness and self-isolation. Now, thank you for agreeing to this, Ms. Maximay. I want to start off with some broad groupings of people that this may affect differently.
Okay, well, especially the elderly, those in the age group of, say, 65 plus, may feel this isolation rather keenly at this time. Young adults, you know, they are accustomed to being out and about, and it's probably difficult to cope with this kind of confinement. But just about anybody, you know, these are unusual times. Just about anybody finds it after a while, you know, difficult to continue indoors all the time. So there are some things that people can do, you know. So perhaps young adults. I guess we're living in a time where it makes it a little bit easier to deal with being isolated at home because we have so much social media, and you know this is what makes it easier to have that connection. So recently people have talked about not saying social distancing but rather physical distancing, because when we have the technology to keep us in touch, it means we do not have to be so much socially distanced. So we can use WhatsApp, we can use Zoom meetings, we can use well, of course, the good old telephone to stay in touch with friends, with loved ones, share jokes, ask how you're going, you know, ask if anything is needed. So all of those things help people to cope better at this time.
What's interesting though is I saw someone make a post today on Facebook saying that even though they're able to use a lot of these social platforms, they have them at their disposal, it doesn't necessarily compare being able to bounce up somebody in the street, randomly driving, and be able to spend some time with that person. So I guess that physical nature to social distancing can still play a part.
Of course. I mean, there's no substitute to you know, being with somebody in a physical way. But the thing is, as this experts have been telling us, this is a new normal. You know, I mean, after this is over, and even when we try to get back to some level of normalcy, it means that it will not be business as usual. So when we meet people in the street, people are now moving towards elbow bumping instead of hugging and shaking hands, right? I guess that kind of social interaction will only be reserved for people within your household, people you're accustomed to dealing with, your closest family. So there's no clear substitute, but I mean we do have to make use of those those platforms that we do have to stay in touch. So certainly using WhatsApp, video calls, having meetings online with our colleagues and friends when necessary, all of those things can help us to stay in touch. People have Zoom parties now, and families can get together over Zoom, share stories, how they've been coping, what's the latest recipe they've tried, how they've messed it up, and how they will try to make it better. So those kinds of things can make a difference. For the elderly, this is a time when we have to be really cognizant of what the elderly are experiencing. Sometimes you have elderly people who live alone, and I think those people are most at risk for developing depression because of the social isolation. If they have been more active socially before this time, it makes it easier. So that things like being in touch with your church, and if you've been, say, in a choir, or you have been a volunteer with your church group, those kinds of things make it easier to now be able to connect with people through social media at this time, so that you can have that social connection. But there are those people who may not be so connected, and so I think this is a time when we have to be our brothers and sisters keeper and look out for our older folks. Give them a call, ask how they're going. If they need anything, perhaps you can just quickly drop it around, not to go in, but just to take it to their place, and hand them over the gate, something like that, just to see how they are. And I would make an appeal to perhaps those who have been, the mental health specialists who have been dealing with them, reach out to them and just, it doesn't have to be a long conversation, just ask how they're doing, because there are some older people who have been falling into our lines, and they are crying, and feeling really distressed. So I think it's important to reach out to those people.
I'm listening to you, and it seems as though there would have been a lot of work going in before to prepare you for the situation now. But with that said, though, are there qualities that someone would have that would make it easier for them to deal with self-isolation at a time like this? I see some people saying, well, introverts have it easy now. What are your thoughts on that?
Well, certainly, introverts are people who tend to need a lot of alone time anyway. They need a lot of time on their own to regroup, to rethink things, to sort of reboot. And so people who are introverts tend to be, shall we say, very active mentally, so a lot of reading, a lot of doing things on their own, learning new things. It's not such a steep climb for them. But we are all social beings, and we all need interaction, even if the introverts might find it easier this time. What makes it easier for them is because they are accustomed to dealing with themselves. They enjoy their own company. They enjoy time alone to breathe, to think, to review interactions with people, maybe to journal, those kinds of things. People who enjoy their own company, those people find it easier to deal with a lockdown, because it's easier for them to find things that they enjoy on their own. So, but beyond being an introvert, there are things, if you find yourself alone, that you can do to make it easier. You can listen to music, you can sing along, because there's nobody to judge you, whether you're out of tune or not. You can start a new hobby. You can maybe adopt a pet, because right now I think TSPCA is still open, so it's possible to adopt a pet even now. So those kinds of things can help people to deal with this this unusual time a little bit better. And yes, so certainly people who are extroverts find it easier, but even so, let's not forget that it's still important to reach out to others and have that social connection, because introverts as well, too much isolation, too much of one thing is good for nothing. That can also affect their mental health if they have no social connection.
All right, so we want to thank you for reaching out, and I'm taking it as getting permission from you to sing in my house outside of the bathroom. But thank you very much, Ms. Maximay, and thank you, T-Tap, Our next scheduled mental health moment will be next Monday, where Dr. Karine Clay will be discussing work-related issues, financial loss, and working from home. And that is what's trending on COVID-19. Remember, you can join us for live coverage on TTT, Chalk City 91.1 FM, Sweet 100.1 FM, Next 99.1 FM, as well as on Facebook at TTT Live Online for all your COVID-19 updates. Thank you for joining us. On behalf of the TTT crew, I'm Dike Rostant. Bye for now.